Dry socket, or alveolar osteitis, is a painful dental condition that can occur after a tooth extraction. It happens when the blood clot that normally forms at the site of extraction either fails to develop, dislodges, or dissolves before the wound has healed. This blood clot is crucial because it serves as a protective layer over the underlying bone and nerve endings in the empty tooth socket. Think of it as a natural bandage that your body creates to cover the wound and initiate the healing process. When this protective covering is lost, the bone and nerves are exposed to air, food, fluid, and anything else that enters the mouth, leading to significant pain and delayed healing. Dry socket isn't an infection in itself, but rather a disruption in the normal healing process after tooth extraction. The exposed bone becomes inflamed, and without the protection of the blood clot, the nerve endings are left vulnerable, resulting in intense pain that can radiate throughout your face. The condition is particularly common following the removal of lower wisdom teeth, though it can occur after the extraction of any tooth. Dry socket typically develops within 3 to 5 days after a tooth extraction and can persist for up to 2 weeks if left untreated. Symptoms of dry socket. The hallmark symptom of dry socket is severe pain that begins typically 2 to 3 days after the tooth extraction. This isn't the normal discomfort that follows dental surgery, but rather a throbbing, intense pain that often feels disproportionate to the procedure itself. The pain from dry socket doesn't respond well to over-the-counter pain medications and can be quite debilitating. Many patients describe it as a constant, intense ache that radiates from the extraction site to the ear, eye, temple, or neck on the same side of the face. When you look at the extraction site, you'll notice it looks different from what you might expect. Instead of seeing a dark blood clot in the socket, you might see an empty socket or a socket that appears whitish due to exposed bone. The area might look dry, and you may be able to see the bone itself. This visible absence of a blood clot is a telltale sign of dry socket. Another distinct symptom is a foul taste or odor coming from the extraction site. As food debris and bacteria accumulate in the unprotected socket, they can cause an unpleasant taste that persists even after rinsing your mouth. This bad taste is often accompanied by bad breath that doesn't improve with brushing or mouthwash. Some patients also experience mild fever, though this isn't always present. If fever is accompanied by significant swelling, redness, or pus discharge, it might indicate an infection rather than just dry socket, which would require different treatment. Difficulty opening your mouth fully, also called trismus, can occur with dry socket, particularly when lower molars are involved. This limited jaw movement can make eating and speaking uncomfortable. You might also notice swollen lymph nodes in your neck or jaw area, indicating that your body is responding to the inflammation at the extraction site. The pain of dry socket tends to worsen when you lie down, which can lead to sleep disturbances. Many patients report that the pain intensifies at night, making it difficult to get restful sleep. Food and drink, especially hot, cold, or sweet items, can trigger sharp pain when they come into contact with the exposed socket. Causes of dry socket. The formation and maintenance of a blood clot at the extraction site is essential for proper healing. However, several factors can interfere with this process, leading to dry socket. One significant factor is the trauma during tooth extraction. Difficult or complicated extractions, particularly those involving impacted wisdom teeth, can cause more tissue damage and increase the risk of dry socket. The increased trauma to the bone and surrounding tissues can disrupt the normal clotting process. Bacterial contamination also plays a crucial role in the development of dry socket. The mouth naturally harbors numerous bacteria, and these microorganisms can break down the blood clot prematurely. Poor oral hygiene before or after the extraction significantly increases this risk. Chemical factors also contribute to dry socket formation. Nicotine from smoking or other tobacco products restricts blood flow to the healing socket and introduces contaminants that can affect clot formation and stability. The chemicals in cigarettes can reduce blood supply to the mouth, impairing the delivery of healing factors to the extraction site. Additionally, the physical act of smoking creates negative pressure in the mouth, which can physically dislodge the forming blood clot. Other than these causes, physical disruption of the blood clot is another common cause. Actions like aggressive rinsing, spitting, drinking through a straw, or touching the extraction site with your tongue or fingers can dislodge the forming blood clot. This is why dentists provide specific post-extraction care instructions to minimize these activities during the crucial early healing phase. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of dry socket. Diagnosing dry socket typically involves a clinical examination by a dentist or oral surgeon. The dentist will ask about your symptoms, particularly the timing and nature of your pain. They'll want to know when the extraction occurred, when your pain began, and how it has progressed. The characteristic delay in pain onset, usually 2 to 3 days after extraction, followed by severe pain that isn't relieved by standard pain medications, strongly suggests dry socket. During the examination, your dentist will visually inspect the extraction site. They'll be looking for the absence of a blood clot or the presence of exposed bone in the socket. A healthy healing socket should have a reddish appearance with a visible blood clot, whereas a dry socket will appear empty or show whitish bone at the bottom. Your dentist might gently probe the area to check for sensitivity, though they'll be careful not to cause additional pain. Treatment for dry socket. The treatment for dry socket is focused mainly on reducing pain and preventing infection. Number 1. Professional dental treatment. The first step in treating dry socket usually involves returning to your dentist or oral surgeon. They'll begin by gently cleaning the socket to remove any food debris, bacteria, or dead tissue that has accumulated in the exposed socket. Then, they will use sterile saline solution to irrigate the socket, flushing out particles that could cause infection or delay healing. After cleaning, they may use special instruments to carefully remove any dissolved clot remnants or foreign material from the socket without causing further damage to the healing tissues. This professional cleaning helps create a better environment for a new clot to form and the healing process to resume. Number 2. Medicated dressings. Following the cleaning procedure, your dentist will likely place a medicated dressing into the socket. These dressings typically contain ingredients such as eugenol or clove oil, which has natural analgesic and anti-inflammatory properties. Other components might include zinc oxide, iodoform, or antibacterial agents. The dressing serves multiple purposes. It provides immediate pain relief by covering the exposed bone and nerve endings, reduces inflammation, and creates a protective barrier against food and debris. Depending on the severity of your dry socket, the dressing may need to be changed every 24 to 48 hours for several days. Number 3. Pain management. Controlling pain is a major component of dry socket treatment. Your dentist may prescribe stronger pain medications than what's available over the counter, such as non-steroidal anti-inflammatory drugs with higher strengths, or, in some cases, prescription pain relievers containing opioids for short-term use in severe cases. Cold compresses applied to the outside of your face near the affected area for 20 minutes at a time can also help reduce inflammation and provide additional pain relief. We actually have a video about 9 fast-acting home remedies for dry socket. You can check it out after this one. Number 4. Home care instructions. Your dentist will provide specific instructions for at-home care that are crucial for healing. You'll typically be given a plastic syringe with a curved tip to gently irrigate the socket after meals and before bed. This helps remove food particles that might get trapped in the socket and cause further irritation or infection. The irrigation solution is usually a diluted salt water mixture or a prescribed antimicrobial rinse. You should continue brushing and flossing other areas of your mouth carefully to prevent bacteria from spreading to the healing socket. Your diet should consist of soft, lukewarm foods that won't irritate the socket or get lodged in it. Avoid alcoholic, caffeinated, or carbonated beverages during the healing period, as these can interfere with blood clot formation and healing. Number 5. Antimicrobial treatments. Although dry socket isn't primarily an infection, your dentist may prescribe antibiotics if there are signs of secondary infection or if you have risk factors for developing one. These medications help prevent bacteria from complicating the healing process. Antimicrobial mouth rinses containing chlorhexidine may be prescribed to reduce bacterial load in your mouth during the healing period. Prevention of dry socket. Prevention is always preferable to treatment when it comes to dry socket. Following your dentist's post-extraction instructions carefully is the most effective way to reduce your risk. These instructions typically include avoiding smoking, drinking through straws, or spitting forcefully for at least 48 to 72 hours after extraction. Maintaining good oral hygiene while being gentle around the extraction site helps prevent bacterial contamination that could dissolve the blood clot. In most cases, dry socket typically resolves within 7 to 10 days with proper treatment, though complete healing of the socket takes several weeks. Remember that while dry socket is unpleasant, it's a temporary condition that will resolve with proper care and treatment. Now, we want to hear from you. Have you ever experienced dry socket after a tooth extraction? How did you manage the pain, and what tips would you share with others going through it? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.